Hello, everyone, and welcome to our Positive Health webinar series, where today we will continue our exploration on the topic of sleep, which can be one of the biggest struggles many women face during their menopause journey. Pharmacist Zeke Medina returns for our part 2 in a session where you'll learn more about how hormonal changes combined with daily mental and physical stressors make it difficult to get enough high quality sleep. My name's Kim Fancher and I will be your host. And with me here today, as I mentioned, is Dr. Zeke Medina, who is a doctor of pharmacy and certified adult sleep consultant, helping people uncover the root causes of their sleep struggles. Dr. Medina runs his own coaching practice where he blends functional and integrative approaches to sleep, stress, and recovery. Thank you so much, Dr. Medina, for returning and sharing even more important insights and tips that can help women wherever they are in their menopause journey.
Hey, thank you, Kim. I appreciate the introduction and having me come back to finish this out. I think there's a lot of great information, and just briefly, I really wanted to highlight some of the things we went over the last webinar. So if you haven't viewed it, this is kind of what you missed out. So in here, we talked a lot about the hormonal cycle of women and how different it is. And even before menopause or perimenopause, women just in general can have different sleep issues because your hormones throughout the month are dancing. They are going up, they are going down. There's things like estrogen that can really excite you and get you going, which could help with exercise and having more energy, but it can also make your sleep a little more restless. And then there's things like progesterone that will eventually climb up towards week 3 and week 4, and then you feel more relaxed, easier to fall asleep and stay asleep. And then we also talked a little bit about, well, what happens when progesterone, which is one of the main ones, starts to decrease because of stress or because of some of the things that we could be doing in our day that causes these hormones to kind of be effective. And so with that, we notice when progesterone can decrease after your week 3, week 4 in your cycle, you can have those sleep issues early on in early adulthood. A lot of us are working more. A lot of us have these iPhones, and so we're constantly battling this constant stimulation. So in the last time we talked about what are those issues that are causing our sleep to be disrupted. So please review part 1 of the series. And then one thing we did do is we broke down how do we fix or reset our sleep. The last time we talked about relaxation and sleep pressure, how and why these are so important so we can allow our bodies to get used to relaxing on a regular basis, in little spots throughout the day in which I do with breaks. I go outside for walks. I might sit down and do a quick 5-minute meditation. I'll work out. I'll stretch. I'll do something that allows my mind to shut off. And it's not always in front of my phone or my computer, because as you know, those can stimulate dopamine and it can also stimulate cortisol if we are on these things all the time. So I try to get away, stop multitasking, stop doing that, and just focus on something that helps my body just reset so I can get back into work later. The next thing we talked about was our circadian rhythm. That's that second box. And then the things that we're going to go over today are how do we define a mental stressor? And how do we define a physical stressor? Because one thing you'll notice is that these all affect what we call the fight or flight response. That's the sympathetic nervous system. Those are just fancy words in calling something a stress response. What is releasing cortisol? What is releasing norepinephrine? What is releasing all these alerting chemicals to stimulate our mind and cause overall, when this is stimulated chronically, it can cause disease of chronic disease, things like heart disease, diabetes. And so much of the literature talks about why stress and managing that is so important. So if you guessed it, relaxation and sleep pressure up at the top there is something that you definitely want to review to just kind of get an idea. Now, when we were looking at the circadian rhythm last time, these are the four rules. That's in webinar one, and that's kind of how we end it. So please review that because today we are going to talk about stressors and what's out there for hormones, right? What's the treatment for hormones? So, what are stressors? Now, this is how our brain detects a stressful situation, right? So when the brain activates this fight or flight response or stress response, I mentioned we increase norepinephrine, right? Norepinephrine from the adrenal gland starts to produce. Our heart rate goes up, our blood pressure goes up. And typically, if we are running from something really scary, that's not a big deal, because it's very temporary. Once we're safe, everything just kind of mellows out. But there are things that we can do in our day-to-day lives that keeps this constantly stimulated. And as you can imagine, do we want our heart rate and our blood pressure chronically elevated all the time? No, not at all. But from there, you also have the extra oxygen that is sent to the brain to improve alertness, to kind of wake you up and get you going. And then, of course, we hear cortisol. Cortisol is not bad. It's when cortisol is unregulated and you are constantly chasing that cortisol spike and drop. But this is when things really start to rev up. So when cortisol is going, it really causes more energy production, more glucose to be produced, and then from there, it's really telling your body, like, I am on a high alert now. I need to be ready. So, this is just some things to think about when you are stressed, and we'll talk a little bit about that. So, there are two really different types of stressors. There's psychological and then there's physical. Now, think about psychological like you're going into a room and you're confronting like a wild animal. You see like a salivating raccoon in the corner, and you're like, I know that thing has rabies. I need to run or find a broom, right? So all of those stress responses are happening in your body right now. You're about to fight this thing or fight it. And chances are, if you got a baby next to you, you're going to crush this thing. So that type of stress response is happening in your body. Heart rate goes up, oxygen hits your muscles, oxygen and blood flow go away from your digestive organs, and now you are ready to full on fight whatever is in that corner ready to attack you. Other type of psychological stressors is think about forgetting about a project at work and that, oh crap, something just happened and you are super nervous. You could get fired, you could get reprimanded. So that type of stress does the same thing. Your brain does not know the difference. This is an instinctual stress response that goes back millions of years, and we literally evolved around it. This is why the stress response takes priority over sex hormones when you are constantly stressed. And that's why they say we got to shut this off. Now, other things to think about: physical injuries. So let's say you hurt yourself, the stress response is typically there. You amps you up. It's a very psychological and physical thing. And the more pain you have, the more of that stress response is going to keep going because you do need those inflammatory factors that are also associated with the stress response. A lot of times uncontrolled inflammatory conditions. So think of things like chronic sinusitis, just the chronic infections. Think about gut disorders like irritable bowel disease, like Crohn's, ulcerative colitis. Those things release a lot of these cytokines that automatically occur from your immune system, and it stimulates the stress response, and it's just a circle of inflammation and stress that's going on in your body. So things like that are physical stressors. Certain things that your body is deficient in, think of nutrients, right? Anything that can cause any type of anemias like iron deficiencies, vitamin B12 deficiencies, folate deficiencies are just a few. But many of us in our population are suffering from things just from regular minerals that we typically would get from food. But since our food is short supply on minerals because of the soil that's being eroded of all of its nutrients because of conventional farming and things like that, we're missing out on things like magnesium, calcium, zinc. And these are the things that we need to create hormones, to create neurotransmitters, especially things like serotonin that converts over to melatonin and therefore allows us to really operate. And of course, there's more. But when we go through this, let's talk about some of the three P's of insomnia that I like to just differentiate. Because one thing that we can really get ramped up on is the emotional part. And so these are sometimes things that we can control. So when I look over at these, we have precipitating factors, right? We have predisposing factors, things that are in our past or in our history of medical history that predispose us to insomnia. And then we have perpetuating factors. So let's kind of break down the definitions of these, right? So precipitating factors are immediate causes, events, or triggers that lead to temporary trouble sleeping. Okay, so I want you to kind of wrap your mind on precipitating factors. There's a lot. Okay, so think about starting a new job. Think about a death in the family, being a caregiver for somebody. What this is doing is soaking up more of your time that you really don't have a lot of and causing you to feel a little bit more stress. Now, that's a precipitating factor, and there's so many more, right? Now, when it's predisposing, like I mentioned, this increases a person's vulnerability or susceptibility to develop insomnia. So, if you are naturally an anxious person, and you're doing certain things to really soak up that stress response on top of being very anxious to begin with, those are going to compound and those are going to make it a little worse, right? So this is going to be very important for you. In addition to that, what other predisposing? I've started working with traumatic brain injury veterans that typically will have a combination of PTSD and a TBI, traumatic brain injury, that will make them predisposed to insomnia just to begin with. So having this type of information and having the visibility on how to identify precipitating factors and how to handle those can help reduce the amount of stress physically and mentally to help relieve that stress response. And that's why this is so important. And then, of course, what I work with people is their perpetuating factors. These are just behaviors or conditions, and a lot of times environmental elements that sustain or worsen their insomnia. So, typically causing it to be more chronic, like over 6 months. A lot of my patients, 10, 20 years, they've suffered with just bad sleep. And it's things like that are very simple. How do we cultivate a relaxation method for you at bedtime that you can do every single night? Because I can give them a blueprint of just a general one, but is that working for them? And chances are they don't want to do it because it's a behavioral thing. It's allowing them to see the motivation or allowing them to feel the confidence of going, this will help you out. We just have to do it, stick with it. And by doing so, when they start getting those little wins, then they become more intrigued. Now they want to do more. So perpetuating factors are typically those things that really make insomnia last much longer. So when I see precipitating factors, this is kind of like the thing that I show people. You have that precipitating factor over there on the left, and there's a couple ways to get rid of these, right? Number one, you can start coping with this stressor. So if you started a new job, if you had a certain special someone pass away, you start to go to counsel or you start to learn more, you just start to cope with it a lot better, reducing that stressor. Obviously, it's still there, but not at the extent of when it was fresh and novice, right? The other way, the stressor just goes away. For example, you have an in-law that's now staying with you, and there's a lot of things you got to do for this in-law because you're the caretaker. And then someone takes that away from you. A sister or a brother moves in and says, hey, we can take it from here. Stress goes away. We're now happy again, right? And then the other way, it typically happens this way for a lot of us, is that we get extremely overwhelmed. And at this point, we have a couple options. The first one, down at the bottom, you just burn out and you can't do anything for a very long time. Your body is recovering. You're probably sleeping more. You're not doing anything for anyone because at this point, you really need to focus on you and recover. The other thing, you ask for help. You either do that or start to reprioritize your task. This is so important because I feel a lot of ladies that I end up coaching, they have so much on their plate when it comes to PTO, work, family, friends, and everyone's asking them because they know you're so good. You're a perfectionist and everything gets done so great. Can you please do this? And I have to tell them, if you are not excited to do this, don't do it. Your mental health is so much more important. So start reprioritizing your tasks. Start getting things away and start giving them timelines. I can't do this after this date because I need to focus on certain things. And that's where that say no to new things. You don't want to get to the part where you're saying yes. Somebody told me if you can't say hell yes to something, don't say it at all. Right. So find things that are going to give you purpose, that's going to give you life to want to do, and really prioritize them so you don't get overwhelmed because when precipitating factors hit, um, you got to handle more things, right? So you want to be able to have that space for your mental health. And when things happen, you can at least handle them a little bit better. So precipitating factors, so important to just to be on the lookout. If you don't know what they are, you can type in precipitating factors for insomnia in Google and a whole bunch will pop up and you can kind of get a better idea. Now, when we look at predisposing factors, you're probably asking yourself, okay, so what exactly um, are these, right? So they can be anything like working night shift, people that just have poor sleep hygiene. I mean, you might have been one of the people that said, I've done sleep hygiene. I tried a few things. It just didn't work. So whatever, that's just think of that like dental hygiene, right? It's not the end all be all, but it is important. You got to brush your teeth, you got to floss to prevent cavities. But it also is your diet, it's also your stress levels, it's also the oral biome, which is the healthy bacteria in your mouth, it's mouth breathing, and so many more things. But it is an important part. So if you don't have good sleep hygiene, let's start to work on this. Pick the lowest hanging fruit from that list of sleep hygiene and see how you can start changing that little by little. Smoking, nicotine, just very stimulating. And then you have medical conditions. We have chronic pain, even acute pain, anxiety or depression, respiratory problems, thyroid disorders, and of course, menopause. It always is going to make that list. And then you have other behavioral factors. So if you're an anxious person that worries or ruminates about certain things, or if you have poor sleep habits, just early in life, I don't know how many people I end up coaching that when I ask them as a child, how was your structure around sleep? And many of them tell me, well, we really didn't have one. I had a TV in my room and I would just watch it until I passed out. And many times it was 3 a.m. They wake up at 6 a.m. for school. And that was just their first perception on sleep. You just kind of do it whenever you can. You take naps here and there. And so your perception on sleep is just so dissected. There's not really a good, healing purpose that you think. So it could be so negative to that. And then, of course, anytime you use sleep aids without medical supervision, you ask a friend, hey, I heard you're taking Ambien. Like, can I try some? A lot of times you might find yourself loving that quick release of just feeling that sleepiness. And then you're starting to depend on that. And when you don't have it, you start to get nervous because maybe tomorrow you have a meeting and you have to get those 8 hours of sleep. So a lot of these types of mindsets and predisposing factors can kind of be a window for insomnia. So just be very careful. Now, we talked a little about perpetuating factors when it came to people that are starting to suffer with menopause, right? These are those behaviors, these environments. And a lot of time, what I end up seeing is we are very tired, throughout the day. And so we want to go to bed early. So a lot of times I find that we're just spending too much time in bed. We're creating a stimulus that is not very conducive for sleep. And instead, it ends up turning the opposite. We become more frustrated. We become more stimulated by the bed because we're trying to fall asleep. But there is a difference between sleepy and tired. Now, with that, having irregular sleep schedules. So if you find yourself taking naps a lot and pushing bedtime back and back, and then finally, when you need to go to bed early, you try and you stay up, that is messing with your circadian rhythm. So that's why it's so important to really look at your circadian rhythm and follow those rules that we talked about in webinar one. And then also stimulant use. I don't know how many individuals I have coached that love a little decaf coffee or espresso before bed. And many of them, they just love it because it just feels kind of like a chocolate bar to them. It's just like one of those after, and maybe their grandparents used to drink this and they go to bed no problem. But for them, it's more restless or they stay up and they mind is always going. So be careful with stimulant use, anything that could have caffeine, or there's a lot of herbs too that are out there. A lot of black tea, green tea, those are all very stimulants as it relates to the brain. And then, of course, there are thoughts and beliefs, right? So this is huge. A lot of us that have had so many issues with sleep, and it's just been a whirlwind. You know, we try certain things, doesn't work. Menopause is coming now; it's even worse. So you constantly are worrying about sleep. You have negative beliefs about sleep, and you perceive sleep very negatively. You know, you might wake up and just be like, oh, I'm so tired. It's because I didn't sleep. And everything is blamed on sleep. This is creating this big belief and picture in your brain that will tell you whatever you do, regardless, it's not going to work. It's not going to help your sleep. You are unfixable. You have to start believing and really receiving that information as more positive, reframing these types of things. So that's why I say, whatever you tell yourself, make sure you are catching it and really trying to help reframe and give yourself a little grace, because things like this can be fixed, but the mind is a very powerful thing. And if you allow it to be negative, it will stay negative. So we have to rewire those neurons by stopping ourselves before we go down the rabbit hole of rumination and switch that to a more positive light, allowing you to have more grace, because we are all human. We're not perfectionists. We have to be human. We have to look at that improvement over that, am I doing it? Yes or no type mindset. And then, of course, we have environmental factors. So think about an unstimulating sleep environment. This picture right here, guy on his computer has a pet with him and a TV, big old TV in his bed. This is unstimulating to sleep. When you go into your bedroom, it should feel safe, relaxing, very calm, that allows you to just really soak in, where you start to yawn, you start to rub your eyes, you start to feel relaxed rather than, all right, like what else am I going to try to multitask and do right before bed? That should not be an environment that you are expecting good results with sleep. So just know you want to use your bed for really two things: intimacy and sleep. If it's outside of that, take everything out at least an hour before bed, just if you're definitely someone that's having issues sleeping. So this is kind of a timeline that I see with a lot of individuals. You know, they're really tired, and so they're like, I want to go to bed. But while they're in bed, they can't really sleep. So they stay awake in bed for sometimes minutes. I always say if it's more than 20 minutes, that's probably, a little bit too long with that association. So it ends up becoming hours to 2 hours, and they go, you know what? If I'm not asleep, I'm just going to pull something out. So they start scrolling on their phone or reading in bed, and now they are creating that stimulation of their bed was a place to think, brainstorm, or be entertained. And what you're doing is destroying your bedroom sleep stimulus. And that leads to frustration or anxiety around bed when you really, really, really want sleep. You can't get it, you know? And then that ends up causing that long term or chronic insomnia that we hear so much about. So This is how just one little behavior change or just lack of knowledge of, okay, I don't want to be in bed unless I'm sleepy. And when I say sleepy, we have those sleeping cues, right? We have the yawning, we have the heavy blink. You might even notice your mind shift focus and things like that. So it's just one of those things to just kind of keep in mind so you don't go to bed just tired, but still wired, right? We want to deactivate that brain and allow our bodies to kind of slowly drift into relaxation and allow sleep to come whenever. But we don't want to be chasing sleep because that allows it to run further away from us. So let's talk a little bit about physical stressors because, as you guessed it, these are all part of the same stress system. And when you are messing with the physical stressors, it's making your mental stressors worse or more sensitive or more hyper focused, right? So if you are someone that, might find themselves constantly feeling stimulated and drained at the end of the day, like I said, tired but still wired, you want to look out for these things, right? So let's dive in. So some of the examples that I see relating directly to my clients are things like irregular light exposure. What does this mean, right? So think about bright artificial light. So if you have LEDs and fluorescence, that's what you work in. Maybe you work in a lab or a cubicle kind of well-lit area. This light is so unnatural for us humans. They have a flicker rate, like they flicker. If you were to record your light and really increase the frames per second, you will see a flicker that your eyes don't pick up, but your brain surely does. And it's very stressful. So, what I try to say is, anytime outside of sunset, we want to start at least dimming these lights, taking away the bright light, and maybe putting a more amber or yellow tinted light to allow our brains to just kind of feel that calmness. The other thing is during the day, we want to focus on going outside as much as humanly possible as it relates to your work. So what does that mean? When you wake up, go outside within 30 minutes to get that morning sunlight. If you don't have morning sunlight, you can use these little clever inventions. This is just on Amazon. This is called a light box. It shines fairly bright. I guess it's not plugged in, so I can't turn it on. But there's about 10,000 lux of light, which is very good to help anchor that circadian rhythm. So I'll use that certain times of the year, especially when I go up north to visit my relatives. But during the day between 10 and 2:30, is the brightest amount of light that you can go, right? Inside right now, it seems kind of lit. This is 500 lux of light, so it's not very much for my brain. Outside right now, it's about 2 o'clock, 100,000 lux of light. That is what we evolved around. That's why our body becomes stressed when we don't have these natural things that we evolved with. So I always say if you can get outside, take some walks with your dogs, hike under a tree, read a book, all of that is super important. Don't go out there with sunglasses unless you're driving or, really doing something where you're operating heavy machinery and things like that. Obviously, use your safety. But you typically want to go there with your naked eyes under a tree, wear a hat. Those are all fine, but the sunglasses does take away from those high lux of light that your body needs to anchor. Now, temperature, when you sleep in a hot or stuffy room, it is just unnatural. Our bodies cool down, and a lot of us will get to a point where one spouse might want it warmer than the other, and then you wake up in a sweat. So try to find breathable, pajamas and things like that, so you can allow yourself to really stay cool as much as possible throughout the night. Another thing that could really help, or not help, but mess with your sleep is just exercising too close to bedtime. I've had a couple men that would go for a big run, like 3 or 4 miles before bed, and a lot of times they were just so tired, and they would go to sleep, but they would wake up 4 hours later, frustrated on what is going on with my body. And I keep telling them, maybe we can really switch out that ability to shift that run earlier in the day and allow our body at least an hour before bedtime to start cooling down. Now, the other things that we see is blood sugar swings, right? A lot of us don't really think of this as a stressor, but anytime you eat something, whether it's high sugar, liquid sugar like sodas, or desserts, or anything that can really increase your blood sugar, candy, what ends up happening is your blood sugar skyrockets, right? It hits your bloodstream very high. Now, your insulin is your counter mechanism. And when your body feels that spike, it just surges insulin into your bloodstream and it causes it to crash. Now, in the brain, when it feels this change, it is going, whoa, this is not okay. We are crashing. And if the brain goes too low in sugar, its response is the stress response. How do we increase cortisol to get that blood sugar back in? So you can literally see people on blood sugar roller coasters because hormones are good, just releasing. Now, this can happen right before bedtime as well. You eat something of sweetness, dessert, you had a soda, or maybe you just kind of switch the order of your food and you ate your carbs first because those always look the tastiest. And what ends up happening? Your blood sugar crashes in the middle of the night. Now you're awake. So you got to be careful with that. And, obviously the excessive caffeine or alcohol, those are calories and those break down. So you got to be very watchful of certain things. And then, of course, I've talked about overtraining and poorly timed exercises, overtraining, like training for a marathon, things like that, that really put your body at stress. um, it's going to be kind of counterintuitive because some people can, acclimate themselves to a stressful workout, and others, we're really just trying to hit the gym hard, lose some weight, but we might find ourselves in that stress category. So just be very careful when you're overtraining, under eating, especially nutrient dense foods, and you're not getting all the nutrients that your body needs to actually burn those types of calories, or build the muscle that you really are looking for. Those can be very stressful on the body as well. Now, stimulants and substances, you know man, I talk about caffeine and coffee, energy drinks, pre-workouts that have caffeine all the time. Very careful on what you are drinking throughout the day. And if you're a one pot a day type of person where you're just drinking that much coffee, maybe we start to cut that in half. Maybe we start to close it off at 12 p.m. and maybe do something warm like an herbal tea. Obviously, nicotine and vaping is not natural to our bodies. There's so many substances and chemicals that are in cigarettes that put a lot of work on your liver. So when your liver has intermediates, meaning it metabolizes something, but it also has to metabolize it a second time to kick it out. Sometimes it doesn't get metabolized a second time. And that intermediate is what we call them in the pharmacy world, gets floated around, starts causing havoc all around the body, hitting different receptors, and it starts putting that stress response back into our bodies. So really, it's just there's so many chemicals that we have to be careful with our liver. And of course, pain. And then one thing that is just not talked about enough is I love how I went from 5, 6, and then number 8. That's how important it is because it takes up two numbers. But the environmental toxins, right? In our furniture, if you notice you've had a couch for a very long time, and when you wake up, you might feel like you have a headache, or a bedroom, a mattress, or old dusty pillows that are maybe used that really soft foamy stuff, that polyurethane or memory foam. A lot of times when those start to break down, you get a lot of off gassing. It can happen with new furniture, like when you get in your new car, you feel that new car smell. That's just chemicals that your body has to detox and things like that. Other things to think about: cleaning products that smell beautifully. A lot of chemicals in those. You want to avoid anything that has that type of fragrance or perfume, because even though it smells so good, your liver is going, oh my gosh, I'm not used to detoxing this. I got so much to do, and now I have all these chemicals coming into my bloodstream, and I have to clean them. So, like I said, strong scents, chemical exposures, and even allergens in the bedroom, they can be very stressful for your body. So, some of the things that I want to go over before we leave is uncommon physical stressors, right? So not everyone's going to have this, but we're going to have those hormonal shifts, right? The menstrual cycle is going to fluctuate. So, like I said, when we're young, sometimes progesterone's going to, be low. Sometimes your estrogen is going to be even higher, which is going to give you symptoms of what they call estrogen dominance. That's not what we want either. We have to have that nice fine balance. When you're in perimenopause, you can start to have that progesterone dip, right? Right in that week 3 and 4, you start to have more trouble sleeping, which is going to lead to estrogen dominance. And then, of course, at menopause, now they're both dipping. And you are feeling not so good, right? You're always having trouble sleeping. When estrogen dips, like I said in webinar 1, it affects our hypothalamus, which affects our temperature regulation. So now we think things are warmer than it actually is, but it really isn't. And you're sweating and you're doing all this like, shakiness. So it's really just kind of, you know, understanding your body, right? So what is the treatment when it comes to these, right? Now, there are conventional treatments, so you can go ask your doctor, and these are just some things to talk to your doctor about. You have clonidine, which is a blood pressure medication. So as you can imagine, it's going to lower your blood pressure, and stopping it abruptly might cause a rebound hypertension, causes a little bit of weight gain, but we've noticed it can reduce hot flashes by 15 to 20%. All right, so it's not groundbreaking or anything. A lot of my clients have been on SSRIs. So, just think of like the antidepressant drug class. So there's so many out there. You got Lexapro, you got Celexa, you have the fluoxetine or Prozac, paroxetine. And really got to take those into consideration because some of them can cause weight gain. Some can cause you to be more alert, but they do help the hot flashes. Sometimes we combine those types of medications with a medication called Neurontin or gabapentin, right there on that second bullet point. And then there's other drug classes called the SNRIs. Those are serotonin, norepinephrine reuptake inhibitors. This is things like venlafaxine, right? So, and those have been fairly effective when it comes to hot flashes. Now, most of my clients that come to me, they're like, Dr. Zeke, I don't want drugs. Like, I need my body to figure this out because sometimes they see that, okay, drugs is just putting more chemicals into their body and they want to be as clean and as healthy as possible. So we try to do other things, right? We talk to them about acupuncture. We talk to them about botanicals. Why botanicals, like foods and herbs? Is because a lot of these have supporting ingredients to help reduce inflammation. It helps reduce some of the byproducts that are associated with some of these hot flashes and other things. So these are just some of the things, isoflavonoids, like from alfalfa, or chickpeas, lentils. So if you have a lot of these on your dietary, you know, plate, I would definitely try to just keep a well-rounded version of these. You can never go wrong with eating more whole grains and fiber because this is helping to metabolize and get rid of extra estrogen and other things that could be building up as well. Now, one thing that's always, always, always thrown around is hormone replacement. Is it harmful? Is it something am I a good candidate for? And me as a pharmacist, if I don't run any tests, there's really no way for me to actually break that down and see. But there is something that, you just want to be kind of familiar with, what are the benefits and what are the differences? Because when you look at hormone replacement therapy, you have the bioidentical hormones on one side. These are hormones that have been created that replicate the exact version of your estrogen inside your body. or your progesterone or your testosterone or oxytocin, right? They are the exact replica. There's no change or difference on it. It works like your progesterone. Therefore, your body goes, ah, I know how to get rid of this. We use it. We're done with it. It's gone. And then on the other side, we have synthetic, right? And this oftentimes does get a lot of negative press because a lot of the side effects that you hear about blood clots and other things, it's mainly because you are taking something like estrogen and you're putting like these chemical compounds on it. And they work on certain things, like many women will take it for acne or potentially hot flashes, and they might get some relief from that. But then you're having this chemical or of estrogen stay inside your bloodstream much longer. Your body's not too familiar on how to kick it out right away, so it does stay in longer. There's been a lot of literature just to show that they stay linked onto your receptors, stimulating those estrogen receptors and other sex hormone receptors. So potentially, when used long term, they can have their long term side effects. So, but just know it's all about the balance, right? When we see people in bioidentical hormones, we see they maintain cognitive functions. They are able to reduce risk of Alzheimer's disease, prevent memory loss. And it is very, estrogen just in general is very neuroprotective. It also lowers the risk of heart disease. There's so many studies with bioidentical hormones to show that it helps to keep the elasticity of the arteries much more vibrant. It keeps the cholesterol down low. And of course, we always hear it, but it does have great effects on the skin as well. But so does sleep. So I'm going to put that in there. Now, when we look at treatment for menopause, I mean, it is always going to be individualized. I mean, your sister could have a different treatment plan that works for her that you do because your diet, your behaviors, your environment, everything's going to be a little bit different. So some things are going to work in others. Now, the goals here is really just how do we alleviate symptoms and prevent disease, right? So think about those long-term things that you hear when people go through menopause: heart disease, bone disease, breast cancer, so many things, right? So we want to make sure that first and foremost, we can prevent those diseases, but then start alleviating those symptoms that is really decreasing the quality of our life. Now, a lot of people ask me, okay, Dr. Zeke, where do I go? Because I hear so much about bioidentical hormones. I talk to my doctor, and they don't want to hear it. They will say, I will put you on this FDA approved medicine. That's it. So bullet point number three is going to be important. Look at this: PCAB or ACHC. These are, they stand for something, but if you type that in compounding pharmacy in your area or close to you, you can talk to one of these pharmacies to see where are the doctors close to you or doctors that they use. You would typically find an easier availability close to you if you live in a big city. Okay, that's just how it is. These are typically pharmacies that do compounding. That's the most common way to get these bioidentical hormones, and they do compounding in such a high standard that they send everything off for testing and making sure the purity and the exact dose is exactly how they compound it. And a lot of times these guys are 1 to 5% off. And just to kind of give you an idea, FDA says manufacturers can be up to 10% off. So they're very precise. So that's why I say if you see a PCAB accredited or an ACHC accredited compounding pharmacy, these are typically the best places to start. Talk to one of their pharmacists, go in, see who their doctors are prescribing bioidentical hormones, you know, try to get an appointment with them just to see if this is something that's going to fit you. And then, of course, the treatment is so much different. Like if you're still cycling, you're going to have a completely different regimen to someone that is postmenopausal. So, what is that difference? So, someone that's cycling, you're probably going to be on things like progesterone, usually given between 14 and 25 days of your cycle, and then you take a break because typically your period happens. When you're menopausal, it can be so many different things, right? You can be on low dose hormones. That's typically recommended. No one's going to put you on those doses that you were at when you were a vibrant 20-year-old. You're most likely going to be in something so low in, but still giving you that protection with your bones and your heart disease. But these doses are going to be low enough to just help maintain the vision, the memory, and like I said, heart disease and alleviate the symptoms. So a lot of women will be great on just those lower doses. Now, if you do use higher doses because you're in that perimenopause phase or you're just about to go into the menopause phase, they might recommend a cycle. So you might find yourself taking breaks from day 25 to day 28, just to give your body a break so it's not, constantly getting that. But when you're on lower doses of hormones, then the cycling can just be up to you. I mean, I have individuals just do Monday through Saturday and then none on Sunday. Or you can do it from day 1 to 25 and then take your break 25 and 28. So it's really, like I said, it's so customized that you really want to find a doctor that does this, knows what they're talking about, and then they can bring this knowledge into your history and be able to give you a good place to start so you can start receiving those symptoms. And then you can do lab tests later on to make sure we are preserving our bone density because that is so important, and then also keeping those high risk heart disease markers down. And I don't just mean doing a cholesterol panel. I mean really looking into high sensitivity CRP, where we're looking at the low grade inflammation that we know is a big cause. Well, not a cause, but it is a big indicator to know that there is something going on in the body and it's not just being elevated through LDL. There's so many other things. So that's why having a doctor that knows what they're doing with the hormones part, but can also look at holistically what is going on in your body and making sure that's staying and you're getting the benefits of your hormones is so important. Now, when we look at testing, this, man, this is, I can write a book about this, and I'm not because there's one that's already produced. So one thing that you will hear, and I'm so sorry if this confuses you, this is why it's important to really look at a doctor that knows what they're doing when it comes to bioidentical hormones, if that's the route that you want to go. When you do salivary testing, this can be very good when you are doing things transdermally, like you're applying the hormone onto your body and you're wanting to see the free amount that is interacting with your body because hormones bind to protein. And when they're bound to protein, they don't do anything. Now, serum is probably the most common and it's a blood draw, right? It can test so many, but typically it looks at the hormones in a total level. You can do free hormones like if estrogen's not attached to that protein. So it is a common area, and you can kind of make a decision on how much hormones you need, but typically salivary is going to be one of the more common ones, which you just spit. They are a little bit more expensive though, right? But it gives you that direct level of what your hormone levels are. Now, blood spot, you hear a lot of people like pricking their finger, putting it in a little sample, shipping it off to a lab, and those can be very ideal for some of like the heart disease monitoring, like if you want to know your insulin levels, blood lipids, vitamin D, even thyroid hormones, and some elements like magnesium. So blood spot can be that way. They do use an algorithm to calculate this. So make sure the doctor feels real comfortable with that lab test. So it's a newer kind of testing that they're doing, very convenient. You can do it at your home. So a lot of people will do that. And then lastly is urine. And there is so much that you can identify through a urine test where there's certain types to do, but this urine basically identifies the metabolites. So if you are someone that is worried about breast cancer and being on these hormones, this urine type testing can show you the three main estrogens and what their concentrations are. And then what are those metabolites from those estrogens? The reason why because number one, we will have certain metabolites that increase your risk for cancers and breast cancer and things like that. And then from there, how are those metabolites getting rid of? How's your body getting rid of them? Are they becoming methylated, which is a type of liver detox? And if so, we can identify that as well. So some of these urine tests, you can have your doctors putting you on different supplements, having you reduce certain things in your diet, having to fluctuate certain hormones, like do we want to give you more estrogen 3, some um, or do we want to give you some more estradiol, right? So we can balance out these downstream metabolites to reduce your risk overall to the sex marking breast cancers and ovarian cancers and things like that. So a lot of cool things you can do by analyzing liver that really goes deeper into what I just went through, but it's very nerdy. So that's why I say you really want to look into a doctor that is very much specialized in this, and it starts with the ones that are prescribing those hormones from a PCAB accredited. And if you have any questions, we can also look for functional medicine doctors too that typically are um, more advanced in training. They have fellowships in these types of things too. Now, when I look at dosage forms for bioidentical hormones, they come in really anything you want. Capsule, this typically, you can get progesterone this way. Estrogen orally is sometimes seen as like a no-go. They either want to give estrogen topically and transdermal, like in a cream, or vaginally, right? Great way to treat a lot of the dryness and things like that when it comes to menopause. Cream, obviously, estrogen. You can also combine that with progesterone and some others. Wanting to go to an accredited pharmacy compounding lab is going to be where you want to start. A lot of these creams can be very much like a weird texture. So having that compound just right is going to be very important. For most men, injection is kind of how they do their testosterone replacement therapy. Not so much when it comes to female hormones. And then they can also create these tablets, or we call them troches. You just kind of cheek them, and the bloodstream by your cheek will help absorb those hormones and to really get them bypassing the first pass metabolism. That's when you take something by mouth and it goes straight to your liver initially. This way, you can put it under your tongue or in your cheek, and it allows you to absorb things without going through the liver right away. So the doses can be lower, and it can be straightforward a lot of times. So I can't stop when it comes to things like this, right? So I like nutrition. Nutrition is like my best friend when it comes to anything related to an imbalance of some sort in the body. So there are some nutrients that we've just kind of seen in, um, clinical studies, as well as some other things that doctors recommend. I misspelled zinc, so please don't hate me for that. But I love zinc. It is something that I typically say, you want anywhere from 15 to 30 milligrams based on, we can do some hair tests as well to see how many of the zinc molecules are in the minerals that are inside your hair follicles and kind of adjust. But just remember, if you're taking more than 20 milligrams of zinc, you might want a little bit of copper, like maybe 1 milligram of copper to balance that out, because too much zinc puts an imbalance on copper. So if you're working with a functional medicine doctor, they will know things like that. But it helps make your sex hormones, it helps make healthy breast tissue, and really it just maximizes that estrogen receptor function. If you are in the medical field and you've heard of zinc fingers, those are the fingers that grab these hormones onto the receptor. And so having zinc is so important. Now, vitamin E, we hear a lot of yes, no, maybe so, but just 400 IU's twice daily has been helped to relieve hot flashes. So if there's something that you want to try, that could be something to do temporarily as these hot flashes you kind of acclimate to them. And then vitamin A and C, these are always important. Obviously, you can have too much vitamin A, so I would very much caution. Don't go with excessive doses, but if you're taking a multivitamin, probably enough there. a professional grade multivitamins are pretty much stacked with minerals. So you'll notice you have potentially like 2 to 4 capsules you have to take. Sometimes the one a day vitamins are just not enough. But vitamin C in general is, water soluble. So taking that throughout the day in multiple doses really helps to replenish, but good for your hormones. We know a lot about folate. Boron is probably one of the ones that we don't hear too much about. So making sure it's in your multivitamin, but it helps increases testosterone and helps to decrease that calcium loss in the bones. It's super good for bone health, like I just said. But one thing to think about is we do want a good amount of testosterone in our bloodstream. As women, you will feel the vibrancy of that testosterone. And when it does dip, you do notice less energy, less ability to do things. So keeping that up is definitely something to think about. And then we can't really overlook this. Fiber, so important. A lot of those cancer causing metabolites from estrogen will get kicked out into the bowel, right? Into your intestines. And that fiber is creating bulky stool, poop, right? And those chemicals and hormones will attach into the stool. And if you're eating enough fiber, it's going to kick that out. So you don't have to worry about that being a high risk factor. If you don't have enough fiber, well, things are just kind of going in and out and nothing really is attaching to the stool, and you reabsorb it and it gets used again. And now your estrogen levels are going up and that risk goes up. So nutrition is always going to be important. Now, this is my last slide, but I will hold it there. Any questions? And it's been great talking through this, and I'm so happy we were able to finish this.
Absolutely, Dr. Zeke. It's been a great presentation, and we're always talking about how each woman's menopause journey is unique, and your insights here really support this uniqueness. And I feel like that's why it's so important for women to track their symptoms, know your body, so that you can share all this information about you with your provider so that you can get the right help when needed.
Yeah, I totally agree. And I don't think you can say it enough. I mean, everyone is always going to be different. And so having a diary of these symptoms and, even through the perimenopause phase, I hear several women talking about, well, I'm experiencing this. I had
Yeah.
no idea this. So it's so important just to have that tracking for sure.
If you could go to the next slide, I just want to mention here that we do have all of our webinars recorded and available out on YouTube. Just for the Positive Health channel out there, and you'll find the previous session that Dr. Zeke did, part one, and learn more in details about what he had to say about estrogen and various things that can impact your sleep. And then, of course, we'll have this one as well uploaded here very soon. Plus, there's all kinds of other menopause related topics shared out there on our YouTube channel. So go check it out. And if we have any future webinars available, you can find those out in our positivehealth.com/webinar site. So you can enroll in any future ones. And here we have our podcast series out on our positivehealth.com/podcast site. We have a variety of topics available where we invite guests to come in and talk to our host, Courtney Pesic. And Dr. Zeke has been a recent guest here when he talked to her. And I think we titled that one Snuggle Up to Good Sleep. So that was a really great discussion on how you can, just little things to help improve your sleep. So go check out all the latest podcast episodes that we have available. And they can also be viewed out on Amazon Music, Apple Podcasts, iHeartRadio, and Spotify. And if you're not already a member of Positive Health, feel free to get out there and join in. It's still free for a limited time. Just go to our positivehealth.com/membership site and you'll find all the information there to join in. And I believe that wraps us up for today. And I can't thank you enough, Dr. Zeke, for all the wonderful information and contributions you've made to this, to our Positive Health webinar series and podcast series as well.
You're welcome, Kim. You have a great one. Thank you.
All right. Take care, everyone. Bye bye.